Are you a yoga teacher? Do you have a fascination, or would you like to learn more about the human body? And would you like to be able to feel that you are confidently providing a really safe but also a really beneficial environment for your students throughout their practice? Through my own time in practicing, through my own practice in yoga studios, but also through my time in clinic as an osteopath and treating patients with pain or with injuries, I have come across it to be quite an evident gap in a teacher's knowledge of the human body. There can be quite an evident gap in their knowledge, but also in their confidence when they're discussing or when they're talking about the human body and their advice or the modifications they're giving their students. And that is why I've created this 25 contact hour course for yoga teachers. My passion and love for this course really came throughout my own injuries. I found that I was so grateful throughout my injuries that I could still come to the mat every day and have a practice. Although my practice looked a little different, I was still able to keep up with the practice and return to my mat day after day. However, I feel that we're giving this practice a disservice when we're turning students away if they have injuries or pain and they're not able to practice. So my aim is that I'm able to educate yoga teachers so that they're not turning any student away regardless of the injury or pain, and that the practice might look a little different for the student, but they're still able to get on their mat and learn and move their body with conscious breath, conscious movement and meditation, which is so important, especially at a time of injury. So why is it at a time of injury or pain that's when we're turning the student away? Because that's when we know they need the practice the most. Throughout the 25 contact hours, you will learn and be able to delve a lot deeper into the body as we separate the course into 6 main sections. The first section is an introduction where we will bring knowledge that you've learned in previous trainings, previous anatomy knowledge, back to the forefront of your mind so that we can move forward together and build on your knowledge in certain areas of the human body. The areas we will mainly be covering will be the shoulder girdle, the pelvis, the upper and lower extremities or the arms and the legs, as well as the core and the spine. We will look at them both individually, but also how do they work together so that we can look at their interaction and the roles that they play or the roles that they should play together. In each section, we will cover the anatomy, so the anatomical landmarks, the bony landmarks, the anatomical terminology, the muscles, tendons, ligaments, joints, connective tissue. So basically the whole structure itself, you will delve into really deep understanding of the structure of those parts of the body. And then we would take that structure you've just learned and that you feel confident in understanding, and we will look at it functionally. So how does it move in daily life? How does it move on the mat or in yoga practice as a whole? But also how does it move when it's not perhaps functioning optimally? So how does it move in each individual asana if perhaps the student is coming to the practice with pain, injuries, or even just anatomical variations? So my belief is that when you have an understanding of the structure, the function of that part, you're then able to really navigate the student and really dictate and talk the student through a class which is going to be the most beneficial, the safest, and also you're then able to give modifications to a really broad and really vast amount of people. So you can cater for your students if they're coming to the practice already with pre-existing injuries. We will really delve deep into the injuries that you'll not only perhaps have the student already come to the practice with, but also, unfortunately, the injuries that may actually, or most commonly, might happen on the mat. We will discuss them in detail, why in fact they're happening, and most importantly, how to prevent this from happening so that you're creating that really safe, nurturing environment for yourself or for your students. My aim is that you will finish and you will leave the course and you will feel so confident when teaching Not only will you feel confident that I can talk or I can take a class using anatomical terminology, I can tell them to put their right foot there and their left foot there, and my alignment cues are really solid and really safe, but I feel so confident when talking about the human body that I'm actually educating my students in their practice about their own body so that they can go on and learn.